Hi class, now we're going to talk about the male and female reproductive systems. So humans undergo what's called sexual reproduction. Males and females are both going to contribute half of their chromosomes to the child, so each are going to contribute 23. So it'll be a blending of their traits. The traits that are passed on to the child will be determined by which traits are dominant recessive within the parents. This is different from asexual reproduction, where there is a budding off of offspring. This usually happens in just like cellular organisms like amoebas and things like that. In these cases, the offspring literally bud off of the parent, and they contain the exact same genetic information as the parent. So it's kind of like making a clone. Through sexual reproduction, the advantage is that you have a mixing of genetic information. And this is really important because the more genetic diversity a person has, meaning the more differing of the traits and that are passed on from each parent, the less likelihood of them having genetic mutations and resulting in, different disease processes. So first we're going to talk about the male reproductive system, then we'll get into the female reproductive system. So the male reproductive system, their function is to produce, transfer, and introduce mature sperm into the female reproductive tract. So all of the male organs are going to be functioning in some capacity to those functions. The reproductive organs can be separated into essential and accessory organs. Some of them can also be structurally supportive, so we'll talk about those too. The essential organs, there's only going to be one, and that's the testes, because they are going to be producing sperm. Sperm are also known as gametes. Gametes are sex cells, so the sex cells of the male reproductive system are the sperm. The accessory organs are going to be most of the other structures, the ducts and organs that support the formation of these sperm and their viability. So we'll talk about all of those in detail. The perineum is going to be a space in between the external male reproductive organs and the anus. It's between the thighs, it's shaped like a diamond. There's a urogenital triangle that contains the external genitals, and an anal triangle that will surround the anus. So the first organ that we're going to talk about are the testes. Testes are plural. One would be a testis. They're small egg-shaped glands. They're about 4 to 5 centimeters in length and weigh about 10 to 15 grams each. They're enclosed in a scrotum, which is the skin sac that surrounds them, and they're suspended in that sac by spermatic cords. Spermatic cords are going to contain the vas deferens and a lot of blood vessels. There's a capsule that surrounds each testis, and it's going to be called the tunica albuginea. Inside the testis is going to be interstitial cells, which are going to produce testosterone, and seminiferous tubules, which are going to make the sperm. The seminiferous tubules are going to be all of these little tiny squiggles in here. And when you unravel all of the seminiferous tubules, they're about 2 feet in length, so that's pretty crazy for such a small gland. So the cells within the testes are interstitial cells. They're also known as Leydig cells, and they're producing the testosterone. Sustentacular cells, or Sertoli nurse cells, are going to protect the developing sperm. So while the sperm are developing, they're actually attached to these nurse cells, and they'll provide them with nourishment as they continue to grow. These nurse cells will secrete inhibin, which is like a negative feedback control mechanism for gonadotropin releasing hormone, LH and FSH from the brain. So it tells those to kind of shut off, that they don't need to make any more androgens, and testosterone being the main one. Subtentacular cells also secrete androgen binding protein, ABP, which is going to allow testosterone to bind. So functions of the testes, the main one is spermatogenesis. So these sperm are being made, and that takes place in the seminiferous tubules within the testes. So we talked a lot about mitosis and meiosis way back when we did cells and tissues. Meiosis 1 is going to produce secondary spermatocytes, and they'll end up becoming more mature sperm throughout the process of meiosis. The testes also secrete hormones, specifically testosterone being the main one. Although, contrary to popular belief, men and women both have testosterone and estrogen, and a lot of other androgens and sex hormones as well. So they both share that, just in differing amounts. So testosterone is going to be responsible for creating male secondary sex characteristics like libido, sex drive, the growth of the larynx and the deeper voice, any body hair, facial hair, development of the muscle mass, and external genitalia. Testosterone actually also stimulates protein anabolism, so if you're trying to grow muscle, testosterone is going to help with that, which is why a lot of athletes end up taking testosterone supplements. Testosterone also stimulates bone growth, so this is why men tend to be of larger stature than women. The structure of the sperm itself. So sperm are actually not even fully matured after ejaculation. They have to be matured once within the vagina. So within the vagina, they undergo a process called capacitation, where the acrosome of the sperm, the part that's over top of the head, kind of like the helmet of the sperm, is going to weaken a little bit with these hydrolytic enzymes that they contain, so that they are able to break down this covering of the egg so that they can fertilize it. So the sperm has four main parts. It has the head, the acrosome, the midpiece, and the tail. The head is going to contain all of the genetic information, the 23 chromosomes, within a nucleus, but the head doesn't contain any other organelles. The acrosome is going to cover the head, and it's going to contain the enzymes needed to break down both the cervical mucus in the uterus and the outer layer of the egg in order to fertilize the ovum. There's also a midpiece, and that's going to consist of a ton of mitochondria, and that's going to be giving most of the energy for the sperm to swim toward the egg. And there's also a tail, which is a flagellum. So the epididymis is this comma-like structure that is going to be coiled, and it's going to be connected to each testis. It's actually about 20 feet in length when it's unraveled. So it lies on top and a little bit posterior to the testes. So sperm that are made in the seminiferous tubules within the testes are then passed through to the epididymis. And then the epididymis carries the sperm to the vas deferens. The epididymis is going to store sperm and nourish them with nutrients for about 1 to 2 weeks. And then the secretions that are made by the epididymis will then be made part of the semen that is ejaculated later on. If there are any unused sperm after 3 weeks of being stored in the epididymis, then those are broken down and reabsorbed by the body. So we said that the sperm that's coming from the testes and the seminiferous tubules is going to go into the epididymis and then be carried into the vas deferens. So the vas deferens are within the scrotal sac as well, and they can be palpated as cord-like structures. They help propel the sperm through the duct system. So these vas deferens are actually quite long. They're going to continue into the abdominal cavity, over top of and down the posterior surface of the bladder. So the male reproductive system actually extends up into the lower part of the abdomen. The vas deferens are going to connect the epididymis with the ejaculatory duct. And they can also store sperm, but and usually a little bit longer than the epididymis. They can store sperm up to a month with no loss of fertility, so those sperm will still be viable once they reach the ejaculatory duct. The vas deferens are what are cut during a vasectomy. So this picture here is showing what occurs during a vasectomy. Usually they cut the ends of the vas deferens and then they seal each end. However, vasectomies can reverse themselves. So sometimes if the ends aren't sealed well enough during a vasectomy, they can rejoin with each other and still cause a pregnancy. So vasectomies are not 100% reliable as a form of birth control. So the vas deferens, like we said, is going to wrap around the surface of the bladder and join with the ejaculatory duct. The ejaculatory duct is about 1 centimeter long. It's pretty short, and it passes through the prostate and terminates within the urethra. So the urethra is the part that is going to serve both reproductive and urinary function. So backing up a little bit, seminal vesicles are going to be on either side of the vas deferens where it reaches the ejaculatory ducts. They are about 15 centimeters in length, and they're near the posterior surface of the bladder, directly in front of the rectum. They secrete most of the fluid that makes up the semen, about 60%. The fluid in the seminal vesicles is alkaline, and that's really important because it's going to neutralize the acidic pH of both the urethra and the vagina, which will make it easier for the sperm to swim in and fertilize an egg. The fluid is also going to contain fructose, which is going to serve as an energy source for these sperm. So the seminal vesicles joined with the ejaculatory duct go into the prostate. So the prostate is going to lie right below the bladder. It's shaped a little bit like a donut because there's that hole in the middle of the prostate for the urethra to go through. We've talked a lot about benign prostatic hypertrophy, or BPH, in the past, and that can happen as a way of the prostate swelling, usually in older aged males. And that can significantly impact both urinary and reproductive functions. The prostate is actually going to contribute quite a bit of the fluid that goes into making semen as well. It secretes an acidic fluid, so it'll balance out the more alkaline fluids a little bit. It's going to contain citrate, so that will also help to nourish the sperm. So they also help to maintain sperm vitality and motility. So the bulbourethral glands are going to insert into the urethra. They resemble peas, both in size and shape, and they're going to secrete an alkaline fluid as well. They're going to also secrete a mucus, and that's going to lubricate the urethra to protect the sperm from friction related to all of them traveling down the urethra during ejaculation. The scrotum is a sac that's going to contain both testes, and it's going to be divided by a septum. The scrotum contains the dartos muscles and the cremaster muscles. Both are responsible for testicular movement. So during times when a male is really cold, those dartos muscles and cremaster muscles might contract to elevate the testes closer to the body. And during warm times, they relax to allow the testes to be farther away from the body. And that's really important because sperm are very sensitive to temperature. So if it's really hot or really cold, those sperm can die off and not become viable anymore. So this is the body's way of maintaining viability of the sperm. And that's why they also say not to take super hot showers if you're worried about sperm vitality, and so on. So the scrotum was part of our structural organs that are going to help our essential and accessory organs, and the penis is also one of those structural organs. It's going to be composed of erectile tissue, so during sexual arousal, it will fill with blood to become erect, and its purpose is to penetrate the vagina during sexual intercourse to allow for that sperm to travel and fertilize an egg. The glans penis is going to be the tip of the penis. The prepuce is going to be the foreskin, if it's intact. And then through the center of the penis will be the urethra, which will contain, which serves as a conduit of both the reproductive system and the urinary system. So seminal fluid or semen is going to be composed of less than 5% of testes and epididymis secretions, which will be the sperm itself and some of the secretions, some of the other secretions that were made in those regions. Most of it's going to be made up of seminal vesicle secretions and prostate gland secretions. And then less than 5% will be that bulbourethral gland secretion, which will have that mucus and that alkaline fluid to protect the semen from friction. So the purpose of the semen is to lubricate, mature, protect, and nourish the sperm throughout their journey to the egg. Male fertility will depend on the sperm's number, size, shape, and motility. Sometimes the sperm doesn't know which direction to swim in. Sometimes they swim in circles, or they swim the completely wrong way. Generally, by the time they reach the fallopian tube to fertilize an egg, the millions and millions of sperm that were secreted, only about 12 of them reach the fallopian tube, because most of them either died from the acidity of the vaginal canal, or they ran into a wall and got lost, something along those lines. Functional sterility is when a male has a sperm count below 25 million per milliliter, because men they create sperm throughout their entire life post-puberty. So after puberty, they make sperm for a long time, which is why you could see really old men who are still having children. Immune fertility happens sometimes when the male body produces antibodies to their own sperm. So that can happen occasionally and can be tested for a type of infertility. So that was the male reproductive system. Now we'll get into the female reproductive system. The function of the female reproductive system is to produce gametes. So again, sex cells, and in this case it will be ova, which is plural for egg. The singular form of that is ovum. The female reproductive system also functions to protect and nourish any developing offspring. Again, the female reproductive organs can be separated into essential and accessory organs. The only essential organs in the female reproductive system are the ovaries, because they are homologous to the testes in males. They're going to produce those gametes. The accessory organs will be anything else: the uterus, the uterine tubes, the vagina, any external genitalia, and mammary glands. So just like men, females also have perineums. They have a urogenital triangle that will contain all of their external genitals, their labia, their vaginal orifice, and their clitoris. And they have an anal triangle that will surround the anus. This is clinically important in females because this area can tear during childbirth. It can tear even into the anal sphincter, which would result in a lot of issues with digestive system function. So oftentimes they would do episiotomies and cut that area before it tears. And that's because if it tears in a kind of jagged pattern, and it's kind of hard to repair. But if they make a simple incision, it's a lot easier to stitch. Sometimes it can even tear through the muscle wall. So there's a lot of things that you can do to try to prevent this while pregnant or before labor. So like I said, ovaries are homologous to the testes in males. They resemble almonds once mature in size and shape. So the fimbriae, or these like finger-like projections off of the uterine tubes or the fallopian tubes, are going to form cup-like structures around the ovaries, but they won't come in physical contact with the ovaries. And that's clinically important because that's how ectopic pregnancies can occur. So the ovaries make the egg, and once the egg is matured, it's ovulated into the fallopian tubes, where it'll be fertilized by the sperm and then come into the uterus to be implanted to grow and become a fetus. However, sometimes the egg, when it's ovulated from the ovary, doesn't make it into the fallopian tube or uterine tube, and it can implant somewhere in the abdominal wall, or it can implant right in the fallopian tube itself, rather than traveling on into the uterus, causing an ectopic pregnancy, which can be fatal to both mom and baby. The ovaries also secrete estrogen and progesterone, which will provide a lot of the functions of the female reproductive system. They provide secondary sex characteristics for the female. They also do a lot with the menstrual cycle and maintaining a good environment for a fetus. So the structure of the ovaries, they have an outer cortex and inner medulla. They have hundreds of follicles that are embedded in that cortex, whereas the medulla contains more of the nerves and the vasculature. Each follicle will contain an oocyte, which is an immature egg. So that egg is going to mature within that follicle every menstrual cycle. A couple of them will. Because every woman is born with the amount of eggs that she'll have, unlike the men. So men can continually make sperm throughout their lifetime, but women are born with the number of eggs that they have, and that's just what they have to work with. So every menstrual cycle, so many eggs will be matured, and then one will continue to be matured the most, and then that one will continue to be ovulated and potentially fertilized. So oogenesis is the formation of these eggs. So the oocyte is going to be that immature egg, and it's going to grow. Multiple layers of these granulosa cell layers will surround a primary follicle, which will develop into a secondary follicle, which can eventually become a mature or Graafian follicle. Only one will become a Graafian follicle out of a handful that develop per menstrual cycle. once that mature or Graafian follicle is released, the ovum is released from that follicle, that would be called ovulation. Within that Graafian follicle, because it kind of burst to allow that egg to be released, blood will fill that space, causing a cramping that's generally felt within the female around this ovulation period. The corpus luteum will take its place, and the corpus luteum is actually considered one of our temporary endocrine organs because it's going to secrete progesterone, inhibin, relaxin, and estrogen. The uterus is a pear-shaped organ. It's going to sit right between the bladder and the rectum, and it can change place depending on your age, if you're pregnant, any bladder distension, and through puberty. Through puberty, it will lower a little bit in your pelvic cavity. And with age, it will too, and with age, it will also get smaller. The cervix is the opening to the uterus. So it'll be the separation between the uterus and the vaginal canal. So when women get a pap smear, they have their cervix swabbed to see if there's any difference in the cells there to detect any changes in case there's cervical cancer. Sometimes retroflexion of the uterus can happen, and that's when the uterus kind of tilts backwards. That can be kind of dangerous, especially if a woman's pregnant. There are 3 layers of the uterus: the endometrium, the myometrium, and the perimetrium, and we'll talk about each of those in detail. The endometrium is the inner layer. It's going to line the uterus, and that's what's sloughed off during menstruation and after a baby delivery. So yes, during menstruation, you get rid of an entire lining of an organ. It's pretty crazy. And after baby delivery as well. Because that was part of what was nourishing the baby throughout this pregnancy. It varies in thickness throughout the menstrual cycle. At its smallest, it's about 0.5 millimeter in thickness. And at its largest, it's about 5 millimeters in thickness, and that's right before you undergo menstruation, as the body is preparing for that egg to be fertilized. The endometrium also is going to produce a cervical mucus, and that's going to act as a barrier to sperm when not ovulating. The myometrium is the thick middle muscular layer of the uterus. Its muscle fibers extend in all directions, which makes it an extremely strong organ, and it has to be because it has to stretch and contract in order to deliver a baby. The myometrium is thicker in the fundus than in the cervix, and that makes sense because the cervix during pregnancy has to widen quite a bit to allow the baby to get through, but the fundus has to be thick in order to contract to push the baby out of the uterus. So that's a good example of structure impacting the function. The perimetrium is going to surround the uterus, and it's going to be continuous with the visceral peritoneal covering of the abdomen. It's absent over the cervix and over several other parts of the uterus. And that can be clinically important when it comes to C-sections and other reproductive surgeries, because when you cut into peritoneum, you risk a high chance of infection called peritonitis, and that can be life-threatening. So because the uterus isn't fully covered by peritoneum, it allows for certain spaces that can be cut into to kind of prevent infection. So it's advantageous for that reason. So the uterus permits sperm to ascend through the uterine tubes or the fallopian tubes in order to find that egg and fertilize it. It also helps to develop the offspring that implants in the endometrium after fertilization occurs. And if fertilization does occur, there's a specific period of time where a placenta has not been fully formed yet. So there's actually glands within the uterus that produce what they call uterine milk, and that's going to sustain this offspring until the placenta is formed. During labor, you'll have rhythmic contractions of this myometrium to help push the baby out. And during menstruation, it's going, as we know, it sloughs off that inner layer of the uterus, the endometrium. And oftentimes women will get cramps, which is actually a fatigue of the myometrial muscles that surround that endometrium. So imagine that you're losing an entire layer of an organ every month. It makes sense that that organ will be a little fatigued and cramping. And being that it's such a strong layer of muscle, it would take a lot to fatigue it. So it's significant when women get cramps. Uterine tubes are also known as fallopian tubes. They're about 4 inches long. They're attached to the uterus, and they sit right outside the ovaries to catch that egg once it's ovulated. It has a continuous reproductive lining with the uterus and the vagina, and it also connects to the peritoneal lining of the pelvic cavity. This is clinically significant because if a woman were to get an sexually transmitted infection like gonorrhea, which can cause pelvic inflammatory disease, she can also get peritonitis, which is life-threatening. And this is because if the infection reaches the uterine tube, which it can, because there is a continuous lining from the vagina to the uterus to the fallopian tube, the uterine tube is also connected to that peritoneum, so it can cause that infection of the peritoneum, causing peritonitis. This only happens in the woman, so if a male were to get the same STI, he would not have any risk for peritonitis because he doesn't have that direct connection between his reproductive organs and his abdominal wall. So any infection or inflammation of the uterine tube is called salpingitis. And through salpingitis, if there is inflammation or infection of it, it can cause scarring, which can be a real concern with fertility because it may be difficult for an egg to traverse through scar tissue in order to get to the uterus to implant. So like we said, the uterine tube extends and communicates loosely with the ovary, doesn't actually touch it. It's the site of fertilization of the egg, specifically in the ampulla of the uterine tube. Once the egg is fertilized, it will go into the uterus to be implanted. The vagina is a collapsible tube that's about 3 inches long. There's no external portion of the vagina that would be the vulva. So the vagina is an actual tube that's internal, and it's going to connect the uterus with the external genitalia. It lies between the rectum, urethra, and the bladder, and this is capable of a lot of distension during delivery of a baby. There's mucosa within the vagina that secretes lubricating fluid during sexual arousal. At times, there's also a hymen that covers the external portion of the vaginal orifice. And that has to be, that covering goes away once menstruation begins, because there's no possible way for the menstrual blood to leave the body with an intact hymen. The vagina serves as a receptacle for semen to bring the semen into the uterus, into the fallopian tube, in order to fertilize the egg. It's also going to serve as the lower portion of the birth canal for the baby to be birthed out of, and it also transports blood and tissue shed during menstruation. The vulva is going to be a blanket term for any external genitalia that you can see. The mons pubis is going to be a fatty pad that covers the pubic bone in women, usually the site of pubic hair development as well. The labia majora are going to be the outer portion of the vulva, and it's going to contain a lot of sebaceous and sweat glands. The labia minora are going to be just medial to the labia majora. The clitoris will be superior to the urethral opening. It's kind of analogous to the penis in men because it's composed of erectile tissue that is also engorged with blood during sexual response. But you only see the glans clitoris externally, so you only see about 5% of it. The rest of it is internal. The prepuce is the clitoral hood that surrounds the clitoris to protect it. And there's also greater vestibular glands that will surround the vagina to protect it from infection. So there are 3 orifices in this area, and that's the urethral opening, the vaginal orifice, and the anus. So the ovarian cycle is going to talk about how these follicles are going to be stimulated to grow and mature an oocyte. So when a woman is born, she has about 250,000 primary follicles that contain oocytes. Those don't start to mature until puberty. This amount of follicles is going to vary depending on the woman and depending on how many she has that mature at a time during each menstrual cycle. So many mature to a certain point, and then they pick the best maturing oocyte that has the best chance of being fertilized, and that's the one that they turn into a Graafian or mature follicle, and that's the one that migrates during ovulation. During ovulation, that's when you see a huge spike in LH or luteinizing hormone around day 14. Endometrial or the menstrual cycle. So this happens when the ovum that was ovulated from the ovaries and sent into the fallopian tubes was not fertilized. So the endometrium in the uterus has been being made to be really thick with blood and nutrients to support this implanted egg, and now it's not going to be used, so it has to be sloughed off every month. So during that time, about 30 to 100 milliliters of blood is expelled. The actual menstrual period, or menses, happens over the course of usually 5 days, sometimes a little longer, sometimes a little shorter. This is going to vary a ton depending on the person. After the menstrual period, there is a postmenstrual phase, also known as a proliferative phase or follicular phase, and that's from days 6 to 13. That's when you have a higher level of estrogen and thickened cervical mucus. Ovulation is day 14. Generally, if a woman is trying to get pregnant, she might check her body temperature because there's usually a drop right before she ovulates, and it raises right after she ovulates. So she can kind of gauge when she should be trying to conceive. The premenstrual phase is also known as the luteal or secretory phase, and that's from days 15 to 28. So those are the days that the body is really thickening the endometrium in hopes that that egg will be fertilized and implanted. So contraceptives. What should you do if you're trying to not get pregnant? There are a lot of different methods. There's hormonal methods, barrier methods, spermicidal methods, and surgical methods. None of these are 100% accurate at preventing pregnancy. None of them. Some of them are 99%, some of them are high 90s, but none of them are 100. Except one of the surgical methods. So with hormonal methods, you can do oral contraceptives, also known as birth control pills, injections and implants, patches, rings like NuvaRings, or IUDs like the Mirena. Those all have hormonal control, so they kind of put your body in a progesterone cycle so that it kind of tricks your body into thinking that you're pregnant so that you don't ovulate. Notice that all of these methods are for women. Men do not take any of the hormonal methods. The barrier methods are condoms, male or female condoms. There are diaphragms and cervical caps also for women. Spermicidal methods involve the use of a spermicide gel or cream or foam in some cases, and that will kill off the sperm. And there's also surgical methods, and that would be tubal ligation, like a hysterectomy, and that would be 100% effective at preventing conception because there are no organs that can help that. But the vasectomies can reverse themselves. They're really effective in most cases, though. Infertility can happen in women as well as men, so generally infertility is defined as failure to conceive after 1 year of trying. About a quarter of women in the entire population experience a period of infertility in their lives. A quarter, 1 in 4. And that's usually due to a failure to ovulate. A lot of women can be infertile due to PCOS, or polycystic ovarian syndrome. On the right, you have a picture detailing a lot of symptoms of PCOS. Failing to conceive is just a small part of all of the issues that can arise from PCOS. Menarche and menopause. Menarche is the first period that a woman has, and it's usually around 13 years old. That's been lowering a ton over the years. Now women or kids as young as 9 have been getting their periods. And there's been a lot of thought as to why, and they think that it's possibly due to a lot of estrogens and hormones that are being added to meats that are being sold in markets. So it's really good to purchase things that say no hormones added. Menopause usually happens between 45 and 50 years old. There's a ton of variation with that too. Usually if you started your period really young, you'll also have a young menopause, and vice versa. During menopause, you have really low levels of estrogen, and that can cause a lot of complications. One of the main things that women complain of is hot flashes, and they also have a lot of vaginal dryness, as well as mood swings and loss of libido. Sometimes women will take estrogen supplements as a way to combat these symptoms during menopause. Breasts are also part of the female reproductive system because they nourish the offspring. There are milk-producing mammary glands. Both men and women have these. Men don't often produce milk, but sometimes they do because of a disease process. Estrogen is going to stimulate the ducts to form, and progesterone is going to stimulate the milk-secreting cells to form. The size of the breast is not related to the ability to produce milk. It's just the size is due to fatty tissue surrounding these lobules and ducts. Alveoli are arranged in ductules, and those turn into lactiferous ducts, which are going to all converge into the nipple where the milk will be excreted. The areola is a pigmented area that surrounds the nipple. It has a lot of sebaceous glands, and that will help to kind of protect the nipple a little bit during breastfeeding from being too chafed. Sometimes the areola and the nipple can change color in light-skinned women during pregnancy, during early pregnancy, so it could change from like a light pink to a dark brown, and that would be a good sign of pregnancy. So lactation is going to be the secretion of the milk for nourishment of newborns. Estrogen and progesterone, like we said, are going to ready the breast for that milk development. The placenta during pregnancy is going to be a huge source of that estrogen and progesterone. So once that is shedded during pregnancy or during labor, prolactin will be secreted by the pituitary gland in order to stimulate milk letdown. Lactation begins 3 to 4 days after delivery, and usually the first liquid that's secreted is called a colostrum, and that's because it's really high in fat. So over stimulation time of the lactating breast, it will make more of a liquid breast milk that will be more rich in proteins, fats, calcium, and vitamins. The colostrum is really, really good for the baby, though. It contains a lot of the antibodies that they need in their passive immunity, and a lot of the fat that they need in order to gain back some of the weight that they lose post-birth. The oxytocin is also going to help stimulate milk ejection into the ducts. And breastfeeding is good for a solid emotional bond because of this oxytocin that's being released. It helps to bond mother and baby. So we have to talk about STDs at least a little bit, so we'll just talk about the most common one. So human papillomavirus, HPV, is the most common STI, sexually transmitted infection. It used to be chlamydia and gonorrhea, but HPV has skyrocketed. It's going to be a cause of genital warts, and it can also cause a lot of types of cancers, cervical cancer being the most common, but also different types of oral cancers. There's about 3 million cases per year. Typically, men are asymptomatic, so they might not even think to get tested, and they can pass this on to women. So get tested. So that's it for the reproductive systems. Let me know if you have any questions.